So, I'd like to start by giving a bit of background on our group, the Toronto Southwest Local Immigration Partnership Employment Working Group. So, a bit about us. This working group brings together service and other stakeholders to improve employment outcomes for newcomers in Toronto. So, through collaboration, the group identifies barriers, shares best practices, and develops initiatives to support newcomers in finding meaningful employment. So that's how this session had actually come about, our working group looking at what the emerging issues are that newcomers are facing. So, overview of today's workshop. So, this workshop will explore the systemic and practical challenges internationally trained healthcare professionals face when re-entering regulated professions. So, despite their qualifications and experiences, many internationally trained healthcare professionals encounter barriers such as delayed credential recognition, the need for Canadian work experience, and limited pathways back into their field. So, the session today will highlight a research based overview of how systemic barriers are shaping the employment outcomes for newcomers, practical tools and strategies to support career reentry into healthcare, and insights from organizations working directly with internationally trained healthcare professionals. So, again, thanks everyone for joining us. And then, so before we dive into our discussion, I'd like to take a moment to introduce our speakers. One thing I did want to mention, we had originally hoped to include a newcomer professional to share their lived experience, but unfortunately they were no longer able to participate, but we still hope that their perspective will be reflected in the insights and work shared by today's speakers who have extensive experience supporting internationally trained healthcare professionals. So first, our first speaker will be Saeed Shah, who is research lead at First Work. Saeed will be sharing highlights from First Work's sectoral research on labor migration in Ontario, including insights into the systemic barriers internationally trained healthcare professionals face and how policy shifts like foreign credential recognition and how the removal of Canadian experience requirements playing out in practice. Next, we'll hear from Holly Best, who is from the uh, from CARE, which is the Center for Internationally Educated Nurses. Holly brings a frontline perspective and will speak to the challenges and opportunities she sees in supporting internationally educated nurses on their journey back into regulated practice, as well as strategies service providers can use in their own work. And finally, we'll be joined by Alan Moyadi, who is from ACCEP, which is the Active Career Connect and Engagement Project for internationally educated health professionals. So this initiative supports internationally trained healthcare professionals by connecting them to subsidized Canadian work experience opportunities and working with employers to build more inclusive and welcoming healthcare workplaces. So again, thank you all. Thank you to all our speakers for being here. We're looking forward to hearing from you, and we can get started with Saeed. So I'll stop sharing and let's see, take.
Okay, thank you, Tinbit. I am going to share my screen. Uh, okay, so here it is. Right. And during the presentation, I may not be able to look at the questions. I'll be focusing on the data that I'll be presenting with you. So if you have got any questions, please write in, or once I've finished, then I'll be able to answer your questions. So first of all, a sincere thanks to Toronto Southwest Local Immigration Partnership for having me here today, and at the same time, the hosting this important discussion. I truly appreciate the opportunity to engage with you folks as we navigate the systematic barriers that prevent internationally trained professionals from integrating into Canadian workforce. To frame our conversation, here is what I'll cover today. The first one, it is Canadian immigration incentives and some of the stats that we have collected. Then we'll focus on Canadian immigration policy framework, then Canadian need for skilled immigrants, and then the focus will be on systematic barriers for internationally trained newcomers. And the last one, I'll put some recommendations and systemic considerations that organizations or the rights group they can share with the group. So first of all, this is the first slide. And here is what you can see is that Canada has the largest per capita in immigration rate. Currently, it is around 6.10 or 6.094 per thousand globally, and its labor market depends mainly upon immigrants. The graph you can see this the census data after, I mean, which is conducted after every 10 years, but from 2000 onward, it is 5 years on. So the last one that is displayed, it is of 2020. So what we see that according to this census, immigrants represent almost 25% of its population and 25% of its population, and 21% was the number in 2011. And it is expected that by 2036, nearly 30% of the people in Canada will either be the landed immigrants or permanent residents. Between 2016 and 21, over 1.3 million people worldwide, they settled permanently in Canada, although the numbers have changed with the recent change in the American government and the latest uh, global crisis, if I may say it like that. There are the change, but the highest number recorded in the Canadian census was in 2013 and 2021, and this has been since 1913. Now, what is it that the people they are interested in moving to Canada? First one is that the Canada, it is a major destination for all the newcomers, including the trained professionals. The reason being is that Canadian population is culturally more diverse than the rest of the world, with people from various backgrounds and nationalities. They are living together harmoniously. Currently, it has the largest number of the foreign-bound population, which is around 54%, where the share of immigrants is higher than of the Canadian population. Many immigrants, it is a preferred destination due to its multicultural landscape, which offers opportunities for newcomers to settle, integrate in its diverse multicultural mosaic. Then its strong, vibrant communities, these also offer a sense of belonging and support for the newcomer, making it one of the most cherished places to immigrate. The last one is the cultural richness, which creates an inclusive environment, making it easier for newcomers to settle and adopt. And what do we see is that the Canadian economy over the last some decades, it has developed a diverse economy, and within North America, it is evolving as a technical tech hub. There are a lot of job opportunities and the potentials for career growth. There is a robust skill development landscape, high quality programs for reskilling, upskilling for the immigrants, the newcomers. There are apprenticeship programs which offer earn while you learn opportunities. And then again, that the Canada, it is turning fast into, it is adopting the digital technology. At the same time, the areas which are booming, it is manufacturing, finance, construction, healthcare that you belong to, information technology, their professional services, education, and agriculture. These are some of the areas that is making Canada a welcome place. Now, from this immigration, what does Canada uh, Canada benefits? The economic benefits that Canada gets are multitude. Immigration, it plays an integral role to address many challenges that Canadian labor market faces, and at the same time, it supports economic growth by bringing younger individuals and talented, skilled professionals. The problems that the Canadian economy is facing, it is that the Canada faces an aging population. It is being forecasted that almost a shortage of skilled workers, nearly 21% of the skilled trade workforce is expected to retire this decade. And it would lead to almost 85,000 new workers just to accommodate these retirements, with almost 300,000 unfilled jobs in critical industries like the one that I've mentioned: skilled trades, technology, healthcare, manufacturing, all that. And for this, Canada needs a skilled labor force. Many immigrants who come here, they possess these skills, experience, qualifications that are in demand in Canadian labor market. They fill these skill gaps in specific industries and occupations which face the shortage of workers. Another thing that the newcomers, they also contribute to the economy by participating in the tax base and spending on goods, housing, transportation, which stimulates economic growth and job creation. Thirdly, immigration, it also brings diverse perspectives, experiences, and the cultural competencies to the labor market. Many immigrants in Canada, they are multilingual or have the proficiency of the languages other than English or French. And almost 40% of the Canadian population, they speak a non-official language, which is other than English or French at home. It is increasing for the last 30 years. International students, they also represent a sizable population in the economic growth. They represent nearly 40% of the new economic class immigrants, many of whom prefer to stay in Canada. So Canadian, if you look at the immigration policy network, there are a lot of programs that Canadian federal and the provincial government, they have initiated. There are economic programs like federal skilled workers, federal skilled trade class, Canadian experience class, Atlantic immigration pilot, caregivers program, and you can see that then there are the family class programs, which is spousal, common law partnership, dependent child, and then the third main category is the refugees, protected persons, and the humanitarian, and the other. This is the Canadian stats again of immigration in the last couple of years. And if you see, I have placed this 2025 twice. Initially, after COVID, Canadian focus was to bring as many immigrants as possible. And you can see that in 2023, we had got 465,000. Then again, with plus 20,000, it was 485. And by 2025, it was expected to be 500,000. However, in the last 1.5 years, Canadian faced a number of different challenges, because of which the government, it changed its policy, and currently uh, out of this, the 500,000, the immigration number or immigrants number has slightly been, not slightly, like it is a significant number that they have decreased. And in the next coming years, if you see that it is decreasing, but that doesn't mean that the Canada does not need the skilled immigrant workers. So this is what we see as the uh, as the issues. Now, moving on, Canada, it welcomes almost what you have seen. At least in 2025, we welcome almost 400,000 immigrants annually, which 60% selected for their skills. Yet, according to Stats Canada, nearly 50% of the internationally trained professionals are underemployed. So almost half of them who move here, they are underemployed. Imagine you are a skilled surgeon from Nigeria, an engineer from India, or a teacher from China, or a nurse from Philippines. You choose Canada, drawn by its promise of opportunity and diversity. You arrive to contribute. But what you discover is that your credentials, these are questioned. Your experience is discounted, and the doors of employment or settlement, these remain closed. These barriers, in a way, they are costing Canadian economy billions, and they are perpetuating inequality. If you see that, the irony here is that we recruit talent to fill the labor gap in these three, for example, industries: healthcare, tech, and engineering. Yet one in the four newcomers with foreign degrees work in low wage jobs. And the cost is what? The Conference Board of Canada, they estimate that the underemployment, sorry, it cost our economy up to 50 billion per year in the uh, lost productivity. Why? It is not about the individuals. It is all about the systemic barriers which do not allow these newcomers to get fixed. What are these key systematic barriers? The first one is this credential recognition complications, the one that we have referred to at the beginning. A nurse from Jamaica might spend 5 years and 20,000 for requalifying. But why? Fragmented provincial system, they have got these inconsistent standards of credential recognition. Then there are a lot of burdensome requirements. For example, the language test, there are some bridging programs, and then the newcomers, they have to face a lot of uh, repeated exams here. Okay, and the result is what? That the 70% of internationally educated health professionals, they remain sidelined. Only one of the one of the reasons. And the other one is the Canadian experience, which is like catch 22. Employers demand Canadian experience, but how do you gain it without being hired? This circular barrier, it hides bias and excludes qualified talent. A study found that resumes with foreign sounding name, it received 35% fewer callbacks. So if your number sounds like kind of foreigner, there are less chances that the people, they would get the jobs. Another is access to networks and the social capitals. Many jobs in Canada are filled through networks. And this is the one many of the bridging programs and newcomer support groups, they insist on that newcomers, they should get in touch with these networks, develop these skills. But many of the newcomers, they lack these connections. Mentorship programs exist, but again, they are fragmented, they are underfunded, and therefore do not bring a lot of positive result. Another is there is discrimination and bias. What we see that racialized individuals, they faced a double penalty. One, foreign credentials plus this racial bias. For example, an Indian engineer with 15 years of experience is told that they are not a fit, which is, in a way, it is a code for unconscious bias. Then there is precarious employment, exploitation. There are these the underlying the black market, black labor markets. That means that the economy, the people, they get the jobs underhand. They do not get into this the Canadian tax system, and they are paid under what the Canadian daily wages or the hourly wages are. The recognition of foreign credentials, it is a core element that the immigrant labor market integration for that they face, and it is a significant factor in determining that immigrants' employment success in their field of training or expertise. While highly skilled immigrants, they come to Ontario for better quality of life and higher financial rewards, they experience all of these systemic and structural barriers due to their credentials not being duly recognized in its labor markets. One primary reason is the absence of, again, the pan-Canadian foreign credential regulation. Pan-credential regulation, there are a number of different bodies which would evaluate your credentials, but across Canada, these are not recognized. So every organization, if you move from one to the other, you have to again get your credentials evaluated. And this is the one that we have been first work as an organization. We have been advocating that there should be a pan-Canadian foreign credential regulator. Once one organization has done that, then the other organizations, they should follow that, and they can work with the federal and the provincial frameworks and can help the newcomers. Another is, according to Employment and the Social Development Canada, there are nearly 500 bodies in 13 jurisdictions, 5 recognized credential assessment agencies. There are numerous professional associations, post-secondary, vocational institutions, and employers. And these employers and institutions are highly skeptical about foreign credential, which cast doubt about the quality and the relevance of international education as well as experience. So many Canadian newcomers, they are forced to do unskilled jobs for survival despite their higher qualification and international experience. In 2014, I remember there was a report published in Ottawa, and that research, it showed that almost 65% of the taxi driver or plus the Uber drivers in Ottawa region, they were PhDs and medical doctors and the engineers, 65% of them. So Canada is not using or utilizing this talented and the experienced force, and are putting them into the jobs which is not fit with their qualification and experience. Moving on, this the Canadian work experience. Um, Employment service sector Canadian work experience, it refers to prior work history within Canada, which is often used by employers as a criteria for hiring. The requirement, it creates a lot of barriers for internationally trained newcomers, even though they possess relevant skills and experience from the other countries. There have been a number of different efforts, and like this Ontario's Bill 149, which aims to ban Canadian experience requirement in job posting, should help address these gaps. However, the broader systemic changes, such as employer education and improved credential recognition, these are needed to fully integrate these internationally trained newcomers into the workforce. Another is this, the Human Rights Commission of Ontario. It has a policy against requiring Canadian work experience, stating that employers must assess all work experience, both Canadian and foreign, fairly. However, despite this policy, many employers still prioritize Canadian experience, sometimes explicitly in job posting or certainly during the hiring decision. They may assume that that foreign trained professionals, they lack knowledge of the industry standards, professional jargon, or the workplace culture. So what are these the policy gaps which are impacting the newcomers? The one are the enforcement challenges. These policies exist like Bill 149, Human Rights Commission's rulings to prevent the discrimination. Enforcement is highly difficult. Hiring decisions often happen behind closed doors, making it hard to prove the bias. Then the regulatory barriers. Some professions require licensing or certification in Canada, which delays employment for internationally trained professionals. Then the third one is temporary work policies. Many foreign workers, they change job, may face delays due to the work permit processing, which affects their ability to transition between different employers. And the most important of all these, the policy gap, is limited employer awareness. Many employers, they are unaware of the policy against requiring Canadian experience and continue to use it as an informal hiring criteria. Another major issue that the newcomers they face, these are the wage disparities, differences in earnings between the immigrants and the Canadians. These wage disparities are the differences in earning between Canadian. There is a substantial wage disparity in Ontario when we are comparing access to employment, recognition of foreign credential and experience. These are influenced by a number of factors like immigrant socioeconomic background, education, work experience, language proficiency, and then again, discrimination bias. For example, the university educated immigrants living in Canada earn on average one-fifth less than their Canadian born peers. Similarly, there is a 14.3% difference in median hourly wages between the university educated landed immigrants and Canadian born citizens. It means again that the newcomers, they with the foreign credential, they earn less, and those who are born in the Canada with the similar qualification, they are earning almost 15% more. The income gap for immigrant women and refugees is much wider, who face much lower levels of median income 5 years after arrival. 25,000 it was in 2018, which was compared to men 36,200 in 2018. So that's the intersectionality. Newcomer with a different color, with foreign qualifications, with experience, all these play different these roles in demotivating the newcomers. Immigrants, racialized individuals, and other minority groups also face these discrimination and the bias challenges in hiring processes and the workplace. These equity deserving groups, they experience the wage inequality, which perpetuates again the social and the economic uh, conditions inequalities, but at the same time these impact the Canadian economy as well. So what are the consequences of this inaction of either implementing the policy? The first one is that 39% of the employers, they are seeking employees with the right qualification and the skill set. Still, in spite of the fact that there are a lot of immigrants, newcomers with with the required qualification and experience, but as they are not recognized, or the barriers that I have talked to previously, they would not allow them to get the jobs. 41% of the employers are seeking workers with the skilled trade training. And it is again expected by 2030, it will leave almost 560,000 unfilled positions, which will result in up to 24 billion in federal revenues. So this isn't just unfair. This policy and this situation, it is unsustainable. Economically, Canada worsens labor shortages in critical sectors, as we have seen that there are a number of professions where they would not have the skilled labors. Social are that newcomers, they face depression, they face eroded self-wealth, brain drain, and many leave for US or the European Union countries, and many of them they leave get back to their homes. And what is it? The moral that we can draw from that is that we are betraying Canadian values of fairness and diversity. Now, what would be the solutions or the progress? On the policy level, Ontario's working or the Canada working as one act bans Canadian experience requirement. British Columbia, it funds streamlined credential recognition. So on the policy level, there are some things which are happening. Employers, the companies like TD Bank and the Shopify, they are using their skill first hiring. At the grassroots level, there is this the Trike and the other organizations which are supporting employers. They have to they get this the audit hiring practices. They have to hire for skills, not just for the passports. They have to fund universal credential recognition and anti-bias training. And what we can do is that as allies, we need to mentor, advocate, and amplify newcomers' voices. Some of these programs I have mentioned here, although across every jurisdiction there are a lot which different organizations, provincial bodies, and the local bodies they offer. And the recommendation is that what we should do, this is the last one, we need to enhance collaboration between government industries, industry, and sorry, uh, industry and the businesses. We need to streamline the processes of recognizing international credentials, experience. Uh, there is already a number of institutions who are providing language training, but the newcomers, they need to be given the training a lot more. Uh, Employment services, there are a lot of the free employment services with government support to help newcomers to adapt to life and the work. But still, it is that this sector need to be expanded. uh, they need diversity and inclusion in the labor force, and that means that the employers, they are to be educated. And the last one is that we need to educate the public about the benefits of this labor market, and we need to dispel the misconceptions which are in some sections of the society. This is all. I am full. You have some questions, and I can.
Thanks so much, Said, for such an informative presentation. It gave us a lot of information to kind of frame what's causing the barrier or the barriers that exist and how we can support internationally trained healthcare professionals. So we'll leave time for the questions at the end. But what I'll do now is pass it on to Holly Best from CARE, who will be able to share a bit more about the work that she does. Thanks.
Thanks, Saeed. That was really informative, and it was heavy information. Most of us have lived that experience, we're living that experience, or we're supporting our newcomers so that they thrive in Canada and are using their experience and diversity and bring a wealth of knowledge to their specialities. I am a case manager at Care Center for Internationally Educated Nurses. And what I do for a living is that I counsel internationally educated nurses to move back into practice here in Ontario. So, Care Center for Internationally Educated Nurses has been around since 2001. And we are something called a Bridge to Train program. So I know that there's a variety of people in attendance today. Feel free to use the chat if there's, something I bring up that you don't quite understand, or if you have a further question, if you are an internationally educated nurse or you know someone who is a nurse thinking of pursuing their licensure, please ask the questions. I know it can be confusing. I know if you are a nurse, you may feel sometimes really empowered and sometimes not. So really that's what Care Center for IENs does. We specifically support IENs. We've been around since 2001. And it's not about just seeing you get your license as an RN or an RPN, registered practical nurse in Ontario. It's more about seeing you succeed in your nursing career. So not just getting that job, but thriving. If you want to become a charge nurse, you can do it. If you want to go back to get your master's and become a nurse practitioner, that's possible. So your success is truly not only CARE's success, but the entire province in Canada, because obviously we need support in our hospital networks for nurses, and it's a very valued career. And it's been my honor working with nurses these past years as a case manager. We have 2 programs, the pre-arrival and post-arrival program called PASS. That is if you are overseas and you have completed your immigration process and you are coming to Canada, you can have support across Canada before you arrive, and we have extended our funding for when you are here, which is fantastic. As I had mentioned, am a case manager for Ontario, and I work for the STARS program. As you are aware, in Canada, depending on the province or territory you are living, the provincial regulatory body will change. So where you are working as a nurse in Ontario will depend on the licensure process and the requirements. And Saeed had brought that up, that's one of the big difficulties for internationally educated health professionals to transition or even to move cross provinces, because it is not a one fluid system. There is some good news. Things are changing. The College of Nurses of Ontario, which is the regulatory body of Ontario for nursing, they have implemented changes and are continually discussing rules to make it hopefully easier for IENs to become licensed, and also more importantly, for people to move across province without less difficulty to provide nursing. So like I said, I'm quite passionate about this. So ask questions. I will share my contact information if anyone has a question, whether you are, an employment counselor and you're referring and supporting, or whether you're an IEN yourself. So at Care Center, we have a very strong client service, and that's based on our values, which is respect, collaborative, compassionate, accountable, professional, and being inclusive. That is how we interact with our nurses, with our public, with our funders, with our stakeholders. And we take this quite seriously. So everything that I do as a case manager, I exhibit that to the public, and most importantly, to my nurses and my team as well. I personally am not an internationally educated nurse. I come from the newcomer settlement background. So I've been supporting newcomers in Canada for the past, I like to say 10 years, but it's more like 20 years. And I absolutely love supporting newcomers. And at times I get quite passionate about it. Sometimes I get a little teary because it's such a great way for me to spend my day. Very quickly, because I don't like to spend too much time on barriers, because A, can make you feel depressed, frankly. And more importantly, these can all be achieved. If you're an internationally educated nurse, you can work in Ontario as a nurse. You can be successful. That's why we're here at Care Center. That's why me and my colleagues at Care do what we do. Most of my colleagues are internationally educated nurses. They're either still working in the healthcare sector, either in acute or in long-term care, or they come from my background, which is settlement and counseling. So the great thing is we have a wonderful team to support you. If there's certain things that I am not familiar with, I can go to my colleagues and they can come to me. So as an IEN, some of the big barriers is first the regulatory process. It's confusing, it's long, it can be costly, and it can even seem impossible at times because of the level of information that an IEN can hear either in their own Facebook groups or on WhatsApp, or they're reading online, or they're talking to people. There's a lot of advice out there. It's not always correct. And this can confuse and misdirect an IEN on a different path that can waste money and time as they're moving towards licensure. So it's really important as an employment counselor to make sure the information that you're providing is accurate. And the only way to find out if it's accurate is if you refer to the College of Nurses of Ontario. They are the regulatory body. They decide the licensure process. They make the decisions. If you're an internationally educated nurse, or you're someone who knows an IEN and you're offering advice, please remember that your pathway as an IEN is unique to you. So all of my members who I work with, they all have a slightly different story and pathway they are taking as they're moving forward with their licensure and they're continuing with their career. Because we all have different challenges in the background. We all have maybe different money restraints. We also may have different credentials compared to other nurses. So for example, as a nurse, you have to showcase evidence of practice. So when was the last time you nursed either back home in the country you were born in, or the country that you worked in as a nurse? Because that's going to reflect on what you have to do to become licensed. Another big barrier, of course, is employment. And this is two sides. The pre-employment side, so you're not a nurse yet, you're working on the licensure, but you need to work. And you have all of these incredible skills as an internationally educated nurse. You're most comfortable in the healthcare system. So the obvious step for many is to go into the unregulated healthcare. So those are roles like personal support worker, being an observer in a hospital, being a patient aide, working in the community, traveling to people's homes. Finding those type of jobs used to be quite simple. If you had an internationally educated nurse experience back home and it was, evidence of practice was recent and you'd been practicing, you could get a PSW job pretty quickly. I'm finding now as a case manager, this is taking longer. There's a couple reasons for that. Number one, employers are being more insistent on people applying to jobs with personal support worker certifications. And those personal support worker certifications are very specific. If you want to work as a PSW in a hospital, so for example, North York General Hospital, you must have a PSW certificate from an Ontario college. And that can be $15,000. So obviously, most of my nurses don't want to spend $15,000 to become a PSW because they want to be an RN and they want to spend the time working on their licensure. So we at CARE help you with your resume, help you with the targeting, help you with the networking. I'll discuss how we do that in a second. But more importantly, connect you with programs, teach you areas that you can apply to outside of the unregulated healthcare sector, so that it's more specific to your roles. But it is taking longer, but it is still possible. The other big thing, of course, is once you get your license as an RN or an RPN, you come out thinking, okay, I'm ready to go. A hospital's going to pick me up. I'm going to work in the ER at St. Mike's right away. It's not going to happen. You're still going to have to network. You're still going to have to make sure you have the correct credentials. You're going to have to make sure for example, your physical assessment skills are up to date. You're going to have to make sure there's certain qualifications. So if you wanted to work in ICU, you wouldn't first move into ICU. You would start in something like a resource team or general medicine ward. And then once you are internal, you can work towards those specifications. Because as you can imagine, you will require certain certifications. So you'll need coronary care 1 and 2 to work in ICU. If you're in labor delivery, there's definitely very specific things you need to have if you're working in hemodialysis as well. But as I know, all my internationally educated nurses, you live a life of continuous professional development. So the path forward for you always learning has always been there. And that's the great thing that we do at CARE. So making sure your professional development is up to date, making sure that you thrive once you get the job, because nursing is not the same across the world. How you effectively worked with your interprofessional care team back home, how you communicated, how you did computer records, how you did verbal reporting will slightly change. It may be very similar or it may be dramatically different. That's the kind of stuff at CARE we want to make sure you're ready for. So up on the screen is the College of Nurses of Ontario, CNO, 9 requirements that you must meet to either become a registered practical nurse or a registered nurse. And depending on those boxes, there are different choices. So this is the nuance for each IEN. And this is where the complications can come in when someone is giving you advice and they told you, oh, I did this, this, and this. You should do this too. And so you follow that pathway and you find out, oh, I can't actually do that for some reason. The reason why is because all of these boxes have certain ways to meet those requirements. The good news is CNO does explain it very explicitly what you have to do and the choices. And the other really good thing is that if you're a member of CARE, we will help you figure that out because it can be a little overwhelming. And we want to make sure that you are doing the right steps to ensure that you get your license accordingly. At CARE Center, it's all about our members. So as you can see in the middle, an IEN is the center of our focus, and around the IEN is the case manager, someone like me. You will be matched with a case manager upon becoming a member, and you will work with your case manager dependent on what you need. So there's no classes that you have to commit to. There are no timelines you have to worry about because we know that the licensure process and finding a job is different for each person. So I have some clients who are with me for the last 3 years. They're still progressing with their licensure. They're working in PSW. I'm checking in with them all the time and it's progressive. Some of my other clients that I've met are already licensed as RNs and they want support with deployment. So I'm helping them make sure, their resume is appropriate to the healthcare sector, specifically for nursing, because it has to look a very specific way. How to target, because you're going to be applying online. So your resume is going to be read by an algorithm. So what does that mean? We're also seeing screener questions being asked. So if those aren't responded to accordingly, you may never get the opportunity to interview, even though you're perfect for the job. So these are all the kinds of things that we do at CARE. We're also helping with your network. We're helping with your professional development, your academic. We're bringing employers to you so you can listen to employers. If you have to write your examinations, so for example, as a registered nurse, you're going to have to write NCLEX exam. If you're going to be a registered practical nurse in Ontario, you're going to have to write the RXPN eventually. So it's all about the one-to-one support. And as I say to all my clients, you're the boss. It's your life. You're driving that bus, and I'm sitting beside you with a map to help you navigate to get to the top to where you want to be. I don't boss you around. I don't tell you what to do, but I give you guidance and support. And I think that's really key because it is your life. You are a professional. You come from an incredible background. You've already done so much in your career, and we're building on that here in Canada. So at Care Center, an IEN or a member, IEN is Internationally Educated Nurse. I apologize for the acronyms I use sometimes. There's 3 boxes. So my members, who are my clients, will find themselves in either the purple box, the blue box, or the green box. So it doesn't matter where you are in the process, I can support you, Care can support you. So if you don't even know anything about how to be a nurse, you're not aware of the process at all, maybe you just arrived and you don't know what's going on, and you're scared and you're confused and you have to work, you can be a member. Let's say you already have your College of Nurses of Ontario application open and they've communicated with you, you know the requirements that you have to meet, and now you need support. We can help you. You've gotten your license, you passed all the exams, but you can't seem to get a job. We can help you. So it's just a reiteration for all of my IENs to understand that you're a member for life at Care Center, and more importantly, we are here for what you need at that time, not what we think you need, which is not great. What I think you need is not as important as what you think you need. Okay, so as part of that Ontario membership, if you are going to be working in Ontario as a nurse, what you get is part of membership. So this helps all of our referral agents as well. So when you refer someone to Care, they will be matched with a case manager, someone like me. They will have access to language programs if they need it. They will definitely be available to all of our professional development workshops. Our professional development workshops are very specific to nursing. So for example, all of our language supportive workshops are geared towards verbal reporting, writing documents to the team, advocating with patients, being assertive rather than aggressive. We also do upgrading skills. So if you want to upgrade your wound therapy, your IV therapy, you want to look at MAID, so medical assisted dying, or you want to upgrade your skills for high risk medication. All of the programs we run are available to you as a member, and you put on your resume, because employers, and this is key, even with getting your license, they will need to see professional development, because in the end, as an IEN and as a nurse, you know it's all about safety. So can you walk into that unit on that floor and offer safe practice to your patients? That is the job of the CNO, and that's why they're there. And that is what the employer is looking for when they're interviewing you. The other great thing we do is mentoring. Saeed had brought it up. There's something quite unique at Care. We do something called observational job shadowing. So that means you're matched with an expert nurse of your choice. So let's say your background was hemodialysis. You can choose to be matched with a hemo nurse who's currently working, and you will shadow their shifts 3 times. So if they're at Sunnybrook and they're doing night shifts, you're going to follow those 12-hour shifts for 3 times at night. You're not practicing, you'll be observing, but you're on the floor and you get to exactly see what the job is like. Because many of my clients are quite nervous of what the job is actually going to be. And being able to be matched and be on the floor to witness it gives them a very good idea if they want to continue, because it may not match what they were doing back home. Or it fits all their boxes, and now they want to see how can they get into that pathway. And they now know somebody, that expert nurse who now knows them. And they're also in an institution. They're seeing what the interprofessional healthcare team is in acute. You can also do it in community as a visiting nurse. You can also do it in long-term care facilities so that you can see what it's like. So a lot of my nurses come from acute. This is quite common for our internationally educated nurses. Long-term care support is not as common as it is here in Canada. And actually, the future of nursing is long-term care. So they have very strong acute knowledge and experience, but they don't have experience in long-term care. And employers are going to want to see that type of experience. So there's lots of training and professional development you can do. And by doing observational job shadowing, you can see what it's like. You also get a membership with Registered Nurses Association of Ontario if you're going to be pursuing RN, or if you're going to pursue RPN, the We RPN. So being a part of those advocacy groups is really great. Plus, they have professional development workshops. They have meet and greets. You want to dive into the nursing world as quickly as possible here. So I tell all my clients, join our Meet the Employer sessions, whether you're looking for a job right now or not, because you should start hearing how employers talk about themselves. And you should start getting the nuance of what they're looking for. Plus, you are also interviewing them in the background. You want to see where you fit. You want to see where your career can advance. Obviously, if you need language support, settlement, financial community, all of that kind of stuff, we can support you. There's a few things we can't do at CARE. I can't change what the CNO decides. They're the decider. We can't do anything about that. All we can do is navigate and support you. And we're not recruiters, so I can't get you a job. But I'm kind of like a resume angel in the background. I'm making sure your application is correct. I'm helping you with your interviews. Interviews as a nurse are mostly clinical questions. So you will be asked very specific clinical questions. Oftentimes you'll be given vital signs. Oftentimes you'll be given scenarios that you would then have to showcase the nursing process. That's what employers are seeking. Not just that you understand what it is, but you can go through the entire nursing process that you are trained in for critical thinking. So practicing that is really important. To be a member of CARE, Canadian citizen, permanent resident, convention refugee, refugee claimant. If you are a refugee claimant, you have to have your work permit. So if you're waiting on your work permit, once you get it, then please reach out to us. There is a language proficiency requirement. It's a Canadian benchmark 7. If you're unfamiliar with what that means, our intake officer will help you. So they'll talk to you on the phone and they'll give you advice of what you need to do to meet that requirement. And if your level isn't quite there yet, we'll give you some support to get ready. And then, of course, to be a member of CARE, you do need to be an internationally educated nurse. So you have to prove that you have a nursing background, or whether you have your CNO already open, or you have your license as a nurse or RPN. And I'll tell a very quick success story about one of my clients. I have too many, which is actually a good thing. These are not my clients. These are just some of our general success stories on our website. But I wanted to talk about Dipti. So I met Dipti in 2.5 years ago. And when I met her, she was living in North York. No, she was in Etobicoke. And she had 2 small girls. Her oldest was in grade 6 and her youngest was in grade 2. Her husband was back home in India, so he had soft landed with her and then he went back home to work while she pursued and started their life here in Canada. So when I met her, she had been working as a personal support worker for 2 years. She was extremely stressed out. She was feeling very defeated and she was getting a lot of how can I say it? Her husband was very concerned, and he wanted her to come back home to India with the kids because he felt that it was taking too long for their life to succeed here in Canada, and he wanted her to come home. But she was adamant that she wasn't coming home. So when I met her, that's where she was at. So she was working on her NCLEX, she was studying, and she didn't have her license yet. And she also didn't know how to get a job. So she was a nurse back home in labor delivery, and that's what she wanted to do here. So the first thing we did was the observational job shadowing that we were talking about. She went on the floor. She saw some labor delivery nurses so that she had an idea that, yes, this is how she wants to do it. She started talking, started figuring it out. She got her license. Then we started working on her resume. We started working on her cover letter, and we started applying. She was offered 3 jobs: North York General Hospital, Sunnybrook, and down at St. Mike's, all in labor delivery, all full-time, all for RN. She chose Sunnybrook so that she could work with complicated care. And just last week, she is one of our mentors. So she is now mentoring IENs at CARE for labor delivery. And she mentored one of my clients who is up in Ottawa, who also wants to go into labor delivery, and really gave her all the key insight. And also that really important gift we all can do to everybody is remind each other that you can do it, you have the skills, and it's achievable. So this is us, carefornurses.org. If you're an employment agent and you're supporting people, feel free to reach out to me. If you're an IEN yourself, I'll put in my contact information. And I just want to thank everyone for your time.
Thank you so much, Holly. It was great to see. I love that we ended it off with the success stories because, as you started, or when you first started your presentation, it's true. Hearing about the challenges and the barriers might be discouraging. So it's always great to hear that it is possible for folks to get back into their field and find meaningful employment. So thank you so much for sharing all of that. Next, I will have Alan Moyadi from Accept to share a bit about the programs that are happening there and the supports that they're providing.
Hi, good afternoon, Tim, but thank you very much. Hi, everyone. Thanks to Syed and Holly for the wonderful presentations that they had. I'm not sure exactly of the context of the participants. It appears to me that it's a mix of service providers as well as clients. So I would, work on my presentation to be good for both, hopefully. Okay, so do you have my screen now? Just want to make sure.
Yep, we can see the screen.
Okay, perfect. So as mentioned, the program is called Accept IHP, which stands for the long name, meaning that we actively engage our clients with the Career Connect, means looking on their career pathways as well as any credentialing and licensing process they have, as well as employment. The program is funded by the Government of Canada, ESDC, Employment and Social Development Canada, the subsection of FCR, which is Foreign Credential Recognition Program. Who we are, in short, Success has been around for about 52 years, is the largest social service provider in BC, but now we have 2 new programs in Ontario. This program, Accept, has been around for about 11 years. It's the 3rd cycle. which is dedicated to healthcare professionals. And we have also a pre-arrival program that is open to everyone with whatever backgrounds, as long as they have PR visa to come to the country. What is specifically our program does, we help the internationally educated health professionals, in short IEHP, moving forward, to integrate into Canada's healthcare workforce by provision of comprehensive support for them, including financial support, wellness, guidance, and mentoring, other features of the program that I will review later on, personalized one-on-one career coaching, as well as group workshops that is going to be for 1 week, and we call it career and employment readiness training. Also working with a case manager to receive guidance on licensing, credentialing, and career development. What are the milestones, how stepwise you can get there. And finally, another component of the program is subsidized placements in entry-level healthcare roles, which again, in another slide, I will explain a bit more. In terms of the eligibility for the program, just to give you an idea, this is an accelerated program. Means that clients need to be career ready. Having said that, for pre-arrival people that we accept into the program, we will just do a bit of like webinars on what the FCR process is for their recognition of their foreign education. Then we accept them with just that PR visa. But for people who are in landed immigrants, we do have a bit more eligibility criteria in place. In terms of immigration status, they need to be either PRs, naturalized citizens, or refugee, well, convention refugee, basically those who have been granted refugee status in the country. Of course, both groups need to be internationally educated health professionals, means they have completed a health-related program outside Canada, whether from their first country or another country. In healthcare, they should have lack of Canadian work experience, means that they whether have been working in like admin or other areas in or outside the healthcare, still okay, but they shouldn't be highly involved in the healthcare, like research, care, different things in the healthcare. At the time of joining the program, they need to be either unemployed or maximum 20 hours per week employed. Having a part-time job is okay. And they need to meet the language level at CLP 6. The program is designed in a way that addresses different barriers that are preventing IHPs from working in the relevant healthcare in 4 main categories. The first category is about licensing and accreditation. We know that these are lengthy and complex processes, and typically a high cost attached to different aspects, licensing, training, membership fees, exams, etc. The other area of barriers is lack of Canadian work experience. Although many employers may not mention it on their job description or reveal it, but still we know they prefer someone with local experience. And there are limited opportunities for IHPs to gain that practical experience, even unpaid, because of high regulations and liability things, etc. in place. So it's like a catch-22. The other area of barriers is limited knowledge of career pathways among the IHPs themselves, as well as the community. So they are often unaware of what are the alternative healthcare roles, how they can take a career path that's still in healthcare, that they can build on their past experience. And also many people who come across and share with them recommendations may be unaware as well. So they need someone who's really specialized in this field. Also, even if the other three are okay, still navigating the Canadian job market itself is a challenging item, usually due to unfamiliarity with the Canadian work culture and communication norms, especially in healthcare field, and lack of Canadian style written application documents, which includes resume and cover letter, sometimes additional letter of interest, and etc. So the program is going to address all of these barriers and hopefully overcome. As mentioned, for pre-arrival clients, we help them with webinars on credentialing. It's less one-on-one, is mostly group service and activities. However, in Canada, support is more focused on individualized coaching, licensing guidance, and practice, and as well as subsidized placement. Of course, there is group sessions, group activities, including 6 days of workshop, additional mentoring sessions, wellness sessions, but those are all optional for the clients. Only maintaining the one-on-one relationship with the case manager, the assigned case manager, is mandatory to have the file open. In a nutshell, what clients would get from the program: as many times they want, we can do resume review, cover letter feedback for any given opportunity they have applied for or planning to apply. Practicing mock interviews for the opportunities that they have scheduled interview for. For subsidized work placement, we opt to 12 to 16 weeks of placement paid. And I'll explain how it works, to what percentage we are going to reimburse the employers. 1 week of workshops is usually from one Monday starting to the following Monday, 9:30 to 4:30. And finally, we have a job bulletin board, which has exclusive access for our program clients and alumni. I'm going to share with you the job board as an example. You see that here is a pharmacist role posted by our BC team. The information of the job is there. What is the compensation rate, location, etc., and the job description. So these opportunities are only accessible by our clients. In addition to the core program, clients are gonna get some other perks, including mentorship and networking opportunities with industry professionals in both group and one-on-one matching context. There is also financial support for key workplace expenses available, up to $300 per participant. That financial support can be exhausted for expenses like uniforms or any kind of workplace related clothing, as well as it's in the clinic or health an environment setting. For example, we cannot pay for suits, but we can pay for scrubs, for nursing shoes, that kind of thing. Short-term certification, micro-credentials like first aid, CPR, WES, or other credential kind of evaluation assessment, and other items like criminal record check even. We do have additional workshops on Canadian workplace culture and REDI, reconciliation, equity, diversity, and inclusion, to ensure the cultural alignment and inclusivity when the clients go to the workplace. And finally, we have mental health and wellness workshops to help them maintain their well-being throughout the transition process. A bit of information about our 6-day workshops. We review the skills for success, job search strategies, networking, using LinkedIn as a tool for networking, resume and cover letter writing principles, and reviewing that. Workplace culture and communication will be explained in brief, and then later on, we will explain a bit more in a more elaborative session with clients. Since it's only 6 days, we are not going to, spend much time on that. Rather, we would go for mock interviews for each and every individual and provision of review and feedback on their performance during the interview. Also, career exploration. So each client is supposed to find what it means to them, the careers that are looking for, and they will be presenting to the rest of the team our their fellow participants, and our team will be providing feedback on how that career exploration tool is working for them. Another wonderful aspect of the program is the overview of the Canadian healthcare sector in general, as well as for each occupation and in different levels, federal, provincial, and municipal, and also the labor market trends in Ontario within the next 5 years. We have trainings both in person and virtual because the program covers clients in further locations across the province. If the client cannot make it during the workshops to come, well, we would see whatever workshop has been scheduled could be done in person or online. For example, in May, we did virtual. June, that is starting Monday, June 16th, will be in person, and maybe we go back to virtual in July. So we take alternates. Our office is located at 791 St. Clair West, which is probably Skills for Change building, the famous head office. We share this space with them. And typically only the workshops take place in person. Other steps of the program, all other features are online, 99%. I'll go quickly to the next one, talking about the work placement. We can pay between 50 to 70% of the wage. We have some matrices. We will discuss what exactly works. But just to have you an idea, for all female clients, the management has decided to go with 16 weeks of work placement. And there is going to be ongoing support and check-ins with program staff in terms of coaching, liaising the information between the placed client and the employer, and any other support that they might need during the placement. Reviewing again the financial support for key work-related expenses. You can view some items here. One point is that unfortunately, these supports cannot be used for licensing, exam, and bridging education or college, university programs. If it's just one course, that's fine. But if it's a lengthy thing, unfortunately, it's not seen in the proposal for the program. How to get started if someone decides to be a client for this program. I share the email of the program with you after you send a quick email, introduce yourself, and give us a bit of what is your educational background and your immigration status. Those are the main two things I would ask everyone to please include in the initial email. Then our admin will be sharing with them a link to do the eligibility questionnaire. If the individual is found eligible to the program, then they will be invited to attend an info session. We run the info sessions regularly on a weekly basis on Tuesday mornings. If someone cannot attend and that time doesn't work for them, we will look for alternative options. After attending the info session, which is pretty similar to what I'm sharing with you here, knowing about the details of the program, if the client finds the program suitable for them, then a registration process would start and the client will be invited to a 1-hour intake assessment with one of our case managers. After the intake and deciding which direction take together, whether they want to be only doing one-on-one or joining the workshops as well, the journey will start with our program. At the end, I'm going to share one of the many testimonials that are shared by clients with us. I only wish that I had learned of this program sooner after arriving in Canada because it would have helped me better transition into the workforce. Overall, this training has been an invaluable part of my career advancement, and I would certainly recommend it to other internationally educated health professionals. So just to review with you, the time commitment in addition to attending info and intake session is the 1 week of workshops and then 12 to 16 week of work placements and availability for biweekly check-ins with program staff. I'm going to share the email address, the website, and the link to self-register for upcoming info sessions in the chat box. And at the end, would like to thank everyone. I'm ready to take any questions you might have.
Thank you so much for that presentation, Alan, and sharing the work that you're doing at Success and how internationally trained healthcare professionals are being supported through your program. So we have about 2 minutes. So if there are folks that have any questions, I just checked the Q&A box and I don't see any questions there, but if folks would like to unmute, you can go ahead and unmute and ask our presenters any questions. And they've put their emails or contact info in the chat as well. So if you'd like to reach out to them directly, you can do so. Okay. Perhaps no questions. Let me just check the chat.
We were obviously extremely clear.
Exactly.
Or we confused everyone and they're all passed out.
I'm gonna go with that
Let's go with
everything
clear.
was clear. A lot of information was shared, a lot of useful information. So we're at time. So I just want to thank everyone for joining us today. I want to thank the presenters for all the information that you shared with us. And if folks